Sally and James are bringing in their 6-week-old daughter Patricia for her checkup. At this visit, nurse practitioner Jordan will be testing a few reflexes that Patricia should be presenting at this time.
Hi Sally and James, I'm Jordan. I'll be the nurse practitioner performing the 2-week exam on your daughter Patricia. Today I'll be performing a few tests to ensure that her reflexes are developing normally and that everything is on track. Do you have any questions before I get started?
Yes, I have a question. Even though Patricia is doing really well, we noticed that we struggle to calm her down and soothe her when she's crying. So we're just wondering if there's anything we could do.
Exactly. We are looking for tips to help her calm down. We're new parents and we appreciate any tips you have.
Well, I'm sorry you've been having a hard time soothing her. Pacifiers often help. Talking in a soft tone, massaging the body, swaddling, holding her on your shoulder. You could also try taking her on a walk, in a stroller, or a car ride. If these don't help, you may just have to let her cry it out, but I hope these will help you.
We definitely will try these techniques with Patty when she starts crying again. I do have one more question though. I'm going to be going back to work soon and James is still working and we're looking for a daycare. Do you have any recommendations on how to find a safe environment for Patty?
When you're looking at different childcare facilities, you should make sure that there's plenty of space, it's not overcrowded, it's clean, and that there's plenty of light. There should be toys appropriate for the age of the child, small chairs, small tables. The toys should be within reach on a low level. That kind of stimulation is important for development. There should be one caretaker for every 3 infants, and when Patty's older, there can be one caretaker for every 6 toddlers. There should be consistent staff so that Patty can make bonds with each caretaker. There should be a flexible schedule with active play, naps, snacks, and meals. The facility should have accreditation from the state, and the caregiver should have training in first aid and safety.
Thank you for that information. We will find a daycare service for Patricia right away.
The first reflex that Patricia will be tested on is the palmar grasp reflex. This reflex is done by having either the parent or the care provider place a finger in the child's palm to see if they will grab on.
Of course, no problem. I'm going to start the examination now. I'm going to start by testing the palmar grasp reflex by placing my finger in the palm of her hand and make sure that her fingers react and grasp my finger. This is important for the future when she's learning to grasp objects to help her sit up or stand up eventually. This reflex is very helpful for future milestones. I'm going to go ahead and do that now. Looks good. Do you have any questions?
Nope. We are glad to see that Patricia is doing well with the palmar grasp. We have noticed that when we put our finger on her hand, she tries to grasp it.
The second reflex being tested is the Babinski reflex. During this reflex, the care provider will stroke the sole of Patricia's foot. When this is done, the toes should fan out and then curl as the foot is stroked.
That is perfect. The next reflex that I'm going to test is the Babinski reflex. I'll stroke the bottom of her foot and her foot should twist and her toes should fan out. The function of this reflex is unknown, but I'm still going to test for it since it should be present at this age. Looks good.
The last reflex being tested today is the rooting reflex. The rooting reflex is done by having the care provider lightly stroke the side of Patricia's face. This is done to test whether Patricia turns her head toward the source of stimulation. For a baby, the source of stimulation is the mother's nipple, since that is where they get their food.
Alright, the final test that I'm going to perform today is the rooting reflex. I will touch the side of Patricia's face and she should turn her head in response to that stimulation. This reflex is helpful in breastfeeding. It helps them find the nipple. Alright. Again, looks good. Do you have any more questions for me today?
Great. Patricia has no problem breastfeeding, so I am glad to see that she is still doing well with that reflex. I do have one more question. Are there any anticipated fine or gross motor skills that we should be looking out for?
So some gross and fine motor function you should see between 3 weeks and 3 months is the ability to grasp, which again, the palmar grasp reflex looks good. At 7 months, we'll be seeing her sit up and crawl. And at 8 months, she'll be able to pull herself up to stand. Is there anything else you need to go over today?
No, I think we're good. You addressed all of our concerns. Thank you.
Thank you for everything. We feel so much better now about Patricia's health.
Great. Good luck, and give my office a call if you need anything.